There are several different types of burns. Radiation burns are caused by too much exposure to the sun. Chemical burns occur when certain chemicals come into contact with the skin. Electrical burns result when electrical current, such as from a power line, comes into contact with the body. Thermal burns are caused by contact with extreme heat. They result in damage to the skin and underlying tissue. The severity of a burn depends on the temperature or strength of the source of the burn, the length of exposure, the location of the burn, the area and size of the burn, and the victim's age and medical condition.
The severity of a burn depends on how many layers of soft tissue have been burned. A superficial burn, also called a first-degree burn, may only affect the surface layer of the skin. The skin is red and dry. A partial thickness burn, also known as a second-degree burn, forms blisters and affects deeper layers of the skin. The blisters may be open and weep fluid, making the skin appear wet. A full-thickness burn, also known as a third-degree burn, is the most severe burn. It affects skin and soft tissue down to the bone. The skin may be brown or black, with tissues underneath appearing white.
Some burns can be life-threatening. Summon EMS personnel immediately if the burns cause the victim to have difficulty breathing. If the burns cover more than one body part or a large surface area. If the burns appear on the head, neck, hands, feet, or genitals. If they appear around the mouth and nose. If they are on a child or an elderly person. If they are burns resulting from chemicals, explosions, or electricity.
Mike, go call 911! First thing we need to do is cool this burn.
To care for burns, flush the burned area with cool water.
This should cool the burn off.
Cover the burned area with dry, sterile dressings. Loosely bandage the dressings in place. Finally, take steps to minimize shock and comfort and reassure the victim.
Now just relax, and I'm going to wait here with you until the paramedics arrive.
Can I get some help, please?
If a burn is caused by chemicals, flush the area continuously with large amounts of cool water. Continue flushing the burn until EMS personnel arrive and take over. If the chemical is dry, brush the chemical off with a gloved hand. Be careful not to get the chemical on yourself or in the eyes of the victim. If the burn is caused by electricity, do not cool the burn or flush it with water. Cover the burn with a dry, sterile dressing and bandage loosely. Take steps to minimize shock.
In review, to care for a burn, flush with cool water. Cover with dry, sterile dressings. Bandage loosely. And take steps to minimize shock.
Now just relax, and I'm going to wait here with you until the paramedics arrive.
And brush dry chemicals off with a gloved hand. Do not use water on an electrical burn. Instead, cover with a dry, sterile dressing and bandage loosely.